Within our practice, we made it a point that we do hair transplant on one patient a day. That we have the best technician, the best equipment, the best technologies. Every person counts, every patient, every client is so unique. And right now we get a lot of patients and clients that just come through word of mouth. So we don't have to spend a lot of money advertising. One person a day, put your 100% energy into it and try to achieve the best result.
A friend of mine had noticed my hair receding and he made a point. And that caught my attention because I was really not aware of it. And then after that I looked at a few pictures, recent pictures at that time, and really noticed it. And as I saw more pictures, I noticed more and more, and I started looking in the mirror, and more I didn't like it and was very conscious of it.
They were always looking at my head, and I started getting comments about what's wrong with your head, you know, what's happening, you know. And I had seen Dr. Sean. He, you know, said that I was a good candidate. I don't feel self-conscious anymore, which is very good.
This is what changes people's lives. This is when they have hair and they have self-confidence. They could walk out there and be themselves. They could talk as loud as they want and feel good about it. That's what really matters. And that's what really changes people. When we started doing one hair transplant a day, that was a significant change. Not a lot of doctors do only one. They want to do 2, 3, 4. There are places that do 6 transplants in a single day. But I wouldn't want to be that 6th person on the chair.
I'm Marc. I'm Dr. Sean's consultant. I talk to everybody who's thinking about having a hair transplant, and I get it. It sucks to lose your hair. I hated losing my hair. I started losing my hair in my 20s, and it affected my self-confidence. It affected everything. And I've had 2,500 grafts with Dr. Sean, and it has probably knocked 10 years off my looks. It's made me more self-confident. I feel like that when I talk to patients, I come from a place of empathy.
Well, I'm a little bit more outgoing than I normally was. I'm much more pleased with myself, and I'm very happy the way it looks and the way it turned out. I just feel happy about myself.
The entire process begins from the consultation, and we prioritize what's important. We strategize. We count how many grafts we could put in. We count how many grafts you actually need. We make a plan, a master plan, and then we try to tackle it. We try to see if we can get more.
Working with Dr. Behnam, I can say that he's so passionate about what he does, and he cares so much about every little detail. And I could say that he wants to give people the honest assessment of their hair loss, of what they can expect from a procedure. And we never ever hard sell anyone. I would say out of every 12 people that we meet, probably 3 of them, we refuse to do their surgery because they're just not going to have a good result. They're not a good candidate. Either they have unrealistic expectations or they just don't have the donor hair in the back.
Overall, the experience was great. They treated me with, you know, exceptional care, and it was, you know, you have to endure the length of the session, but they took very good care of me.
Then comes the day of the procedure. Me and you, we discuss the plan over again. We make sure that our expectations meet, that you know what I want and I know what you want. Once that is done, we basically numb the back of the scalp and we move the strip, close it. Once the strip is done and we close it, then the next phase begins, which is creating the sites. Now, creating the sites, these are the sites that the grafts are placed into. Every angle, every direction is important. So when we try to graft 2,000 hairs, that's every one of those graft sites have to be at the precise angle and direction. So sometimes I spend 1 to 2 hours making sure everything is just to match. I also have my technicians who assist me. and they dissect the grafts. And once I, create all the sites, they basically, just slide them into the sleds that I create. People could bring their own DVDs or CDs to watch a movie, but most people just want to take it easy and just sleep or just chat with me and the assistants. So from the beginning of the procedure till the end, I oversee every aspect of the procedure, from the numbing to the removal of the strep, to the closure, to the site creation, as well as to placing of the grafts. Now I have specially trained technicians that insert the grafts into the sites, and this is all they do. They dissect the grafts and they place the grafts under my supervision. The entire process actually begins even prior to the procedure. You as a patient have a homework. 2 weeks prior to the procedure, doing a special scalp exercise that increases the elasticity of the skin in the back of the scalp. This leads to decreased tension. Decreased tension leads to decreased and minimal scarring. So by the time that the procedure day comes around, the back of the scalp is very elastic, and I could take this strip and I could close it without any tension. Now I will add a couple more things to it. Rather than just closing it once, I close the tissue twice. It does take more time, but this is the reason I leave the entire day for one patient.
It's not just the hair you get, it's the idea that you have a problem and then you did something about it. Sometimes that little bit of personal accomplishment can make you feel better than the hair.
I just feel more confident about being out and knowing that I have hair. It's something that I was always very self-conscious about, that I was losing my hair. And like I said, going back to my 20s, I felt in my 20s, I'm losing my hair, I'm losing my hair, I'm losing my hair. And all through my 30s, I'm losing my hair until I finally reached my 40s, and I really was losing my hair. And I had to just do something about it, and I did, and I'm happy I did, and it definitely has changed various different aspects of my life, I think.
Actually, my hair grew back a lot sooner than predicted. They were telling me 9 months I'll start noticing it, and my hair actually started growing back 4 months, approximately, and the recovery has just been phenomenal.
I was very pleasantly surprised that I don't recall any pain. It's been a year now, and I was thinking back, was there much pain involved? And I'm sure if there was pain, I would have remembered it because of the type of person I am. But I don't recall any discomfort at all.
Every one of my patients have my direct cell phone number. So if they need me, any time of the day or night, they just call me up. Not that people need it, but the comfort that the doctor is right there next to you 24/7. You don't have to jump through any either answering service or secretary to reach him. After every hair transplant, I give 10 complimentary laser sessions. Well, we do it because we know that patients get better results. They come back. Every time they come back, I get a chance to see them, address a small concern that they have. And these little concerns go a long way. At the same time, they get a laser session that stimulates the grafts. They get earlier, faster growth. We're resolving issues, and it works very well.
Well, I was taking a shower, I got out, and I was drying my hair, and decided to comb it, and I was like, hey, what's the skin doing on my head? It should be hair. So I did the old 2-mirror check over, and I was like, oh boy, I'm missing. So I said, you know what, I'm gonna do it. It wasn't bad at all. It was real nice. The staff was excellent. I like it when the wind blows my hair all over the place. It's nice.
My goal is to put in as many grafts on top of anybody's scalp as possible. Why? Because if you get a great result, you're going to be happy. Once you're happy, you're going to refer other people. So my goal is to make you as happy as possible. And in order to achieve that, the flat fee pricing really works well. Because with a special flat fee, I do the maximum amount of grafts I could do in a session. And if you do a great scalp exercise, where the back of the scalp is loose, I can take more hair. So you do your homework, and we get extra grafts, you become happier. And the fact that we only do 1 case a day, we'd like to just put as many grafts as possible.
The way the clinic is structured, the doctors are twin brothers. You got Dr. Sean Behnam, who is a medical doctor, hair transplant, hair loss specialist, who does hair transplants, and we only do 1 surgery a day. And you have his twin brother, Dr. Ben Behnam, board-certified dermatologist that does everything from wrinkle reduction to cancer removal. So as Dr. Sean is seeing 1 patient a day, Dr. Ben is seeing 30 patients a day.
But I'm really glad that I ultimately made that decision. I'm really happy looking at myself in the mirror at my hair.
There's nobody else waiting, there's no rush. And the flat fee pricing has well integrated itself into my philosophy of doing 1 case a day, and it has worked very well.
If you're unhappy with the way you look, if you're not happy with your hair loss, you don't have to be. You can come here. Dr. Behnam will give you a full-blown hair loss analysis. He'll tell you exactly what you can do for it, and you can decide.
Thanks so much for watching. And if you're losing your hair, or if you know anybody who's losing their hair and it's impacting their life, come down to my office. I will do a one-on-one free consultation with you. I will do a hair analysis, scalp analysis, provide you with all the medical and the surgical options currently available, and you decide what you want to do with it. Thank you.